Professor, Physician, Epidemiologist. I am Dr. Sri Banerjee. Hi, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this video, I'll be going over the important topic of health literacy. When you're thinking about health literacy, within the clinic or within your encounter, patient encounter. If you're in healthcare, you have patient encounters, and um, within those encounters, oftentimes it's important to communicate in a way that patients and their families would be able to not only understand and process the information, but then take that and be able to comply to whatever treatment regimen that you have provided for them. On a social population level, that also means that you will need to kind of capture that. So patient-physician communication, the quality of patient-physician communication, and what type of connection is being made. Just in that first encounter, when you're taking the history, a lot of times in that um, you can get a sense of how you really need to communicate to best get through. A lot of times, there's a need for health advocates who can kind of then be that third party who translates this. Looking at the distribution of health literacy within the United States is quite revealing because of the fact that there's certain pockets here where health literacy is really low. If we look at one of our largest states, Texas, the southern part of which has higher rates of health, have higher rates of literacy. Um, but then when you look at the lighter portions of the state, those places, the adult literacy and numeracy. So numeracy looks at actually the ability to do simple arithmetic, math, things like that. Those areas that are light blue are areas of concern. So those are places that have a potential for intervention. So what you do is you go into Healthy People 2030 and try to take a look at what the corresponding interventions are. So I'm going to switch to Healthy People 2030 at this point and see what we can find with health literacy. So this has to do now with Healthy People 2030. This is the actual website, very recently updated, and I was quite impressed by the 2.5 minute video that Rachel Levine put together for this resource. So if you get a chance, please take a look at that. You can kind of find it. You can find it in Google. And so this is something that is interesting because it's not enough just to have and mention domains, but also what it's actually doing. So just the objectives that are pertaining to this: increasing the proportion of adults whose healthcare provider check their understanding. Um, Decrease the proportion of adults who report poor communication with their healthcare provider. So, as you can see, this has a lot to do with patient-physician communication. And what is even more interesting to look at is this dashboard. And this, to me, says it all. Because not only is it giving you the target that you're trying to reach, and in terms of proportion of adults whose healthcare providers check their understanding, our target is about a third. That's what we're hoping for, and only a quarter actually do this. So we're trying to get it to a third. And so there's a increase desired. Um, and so there's a that data source has been identified. So now there can be a checkpoint to make sure that we're headed in the right direction. There's also an active working group. Um, Health communication, healthcare access and quality. Healthcare access and quality is the main domain that this falls under. And then health communication and health information technology working group. These are all the agencies that are working towards that. Um, so this is kind of a uh, methodical way that you can piece through, understand a specific topic, and then go further in and in depth and understand it better. So in the next portion, I'm going to go over a peer-reviewed scholarly article to show you how you can use social determinants of health to explore a lot of these articles. So here is a an article that was written by Nutbeam and Lloyd, and it's in the Annual Review of Public Health. And the name of the article is Understanding and Responding to Health Literacy as a Social Determinant of Health. And it's put together by some collaborators in Australia, and this goes into a little bit more detail about kind of a gradient. Um, and so it's not um, so health literacy is kind of those one of those midstream determinants, which is not a main determinant. But understanding just how much health literacy plays a role in the current literature, it's not really there as strongly as it should be. So existing interventions demonstrate the feasibility of improving health literacy among high-risk populations. But just how to do that, that remains unclear. One way I showed you by understanding targets and then designing interventions towards those targets from HP 2030. But looking at the disparities, inequalities, and inequity. And they go into the language, and I think this is kind of a crucial place to talk about this. And that's why I like scholarly articles because when you take a look at a topic, you can go in a lot more detail and focus. So disparities, inequalities are kind of used interchangeably, but one phrase that is really captures it all is equity and inequity. So health inequity is more of a value laden term. So um, there is a lack of social justice and fairness. That's it. That is health inequity. Um, so coming to terms with terminology. What does literacy mean? And if I were to honestly write a similar article, I probably would start describing this from a medical terminology perspective because it's so important to kind of look at what's there. I also wanted to focus on the fact that the authors did mention not only the framework, this main social determinants of health framework, the World Health Organization commission that created this, but they also did have a reference to the United Nations Sustainable Development Goals adopted in 2015. And this there's 17 of them. This you should be able to kind of immediately know in your head that certain numbers correspond to certain goals. So these are what's nice here is that the authors go in and talk about different facets. Literacy is also not something that's a fixed asset. Um, People can improve their skills by understanding and learning more. Um, and looking at now, this portion is also interesting because there's different types of health literacy. There's functional health literacy, where you can kind of get by with the basic information and knowledge that you have. But then when patients have interactive health literacy, this is requiring a little bit more advanced skills because it's allowing now not basic interaction, but the ability to simultaneously extract pertinent health information. So it takes multiple levels of attention when you're not only interacting, but then also speaking in a language that is not typically normally something people would talk in. So then we're talking about critical health literacy, and that is the most advanced literacy skill to have. And this is because now what you're doing now during your encounter. So I'm describing this from the perspective of the patient. Let's switch roles. Usually I'm talking about from the physician's perspective, but let's switch roles. And so now I'm talking about it from the patient's perspective. And so the patient not only now is uh, having regular interaction with the physician or healthcare provider, but then they're needing to kind of understand and grasp more technical medical concepts. And then on a higher level, they are having to process and put together information cognitively to have critical health literacy. And that depends. This part really depends on understanding the social, economic, and environmental determinants of health. Um, so this part, critical health literacies, is not something that necessarily can be achieved until there's support groups, advocacy, lobbying, more awareness. And these are areas where institutions, medical schools, and learning institutions can aid in as well. But overall, this is all connected to the social determinants of health. Um, so these are the important parts of this article. Um, what I also want you to note is that the novel ideas and concepts are only found in peer-reviewed, more recent peer-reviewed scholarly journal articles. Um, this is not written in the typical form, the traditional introduction, methods, results, discussion. This is more written in the form of a review article, but it allows you to really learn a lot of information in a short amount of time. So this article is about 19 pages, but you don't have to necessarily read through every single word. You can kind of skim through it. Um, they also go into then talking about the European Health Literacy Survey and specific measures. And it's important to pay attention to these specific measures because this is the way that you can assess uh, parts of domains of social determinants of health. This is concrete ways that you can do that. Um, then this is the authors go into talking about the mediating determinant of health. So maybe directly this is not uh, causing, it doesn't have an effect, but then mediating um, in addition with, so something has a cause on health literacy, causes health literacy or is associated with it, and then health literacy is associated with that, with the outcome. So it's so midstream interventions are needed. So this then goes into interventions, concrete interventions. They go into teach back being a wonderful communication technique. For instance, you explain something and then try see the client or patient understood what it is that you're saying. Um, and then there's other interventions and training as well for frontline professionals. So this is the different facets and different perspectives through which you can understand health literacy. So what are the key take-home messages here? Number one, health literacy is an important part of social determinants of health. Uh, Number two, health literacy can be approached from a community perspective, understanding geospatially where there's higher levels of health literacy and lower levels of health literacy. And then also, number three, we're looking for ways within the scholarly um, journals and articles on how to implement successful health literacy interventions. Um, so I hope this has made sense, and thank you for listening.